If you've got a case of a bleeding radial artery, let's say you're a doctor in the emergency department, you're a surgeon, or you're a plastic surgeon, or you're a nurse, or you're just someone, not a medico, who happens to see someone bleeding from the wrist. Or if you ever cut your wrist by accident, what do? The artery is going to spurt blood like anything, is just going to go very fast. So in the upper limb, we have the main arterial supply by the brachial artery that divides into two, the radial artery and the ulnar artery. The radial artery is dominant in most people, whereas the ulnar artery is the dominant artery of the hand in a minority of people. But then, even if the radial artery is dominant and that gets cut, the hand may survive on the ulnar artery because the dominance is not 99, 1% or 90, 10%. It may be 60% and 40%. So even if 60% of the blood supply is gone, the 40% remaining from the ulnar artery may be able to save it. But who knows, the amount supplied by the ulnar artery may be very less. So anyway, whatever happens, it's best to repair the artery like before. Sometimes it may be irreparable, but then we should save the bleeding artery in such a way, we should stop the bleeding in such a way that it is repairable later for a anastomosis of the cut parts or ends. So whether it is the radial artery that is cut or the ulnar artery that is cut, when there's bleeding, people try to put a tourniquet over here with a belt or something like that. Or they try to press on over here, but then they carry the limb like this down below. So even if they are putting pressure, it doesn't really stop. And then a doctor who is less experienced or a medical who's less experienced, they put a tourniquet over here, or they may use a BP cuff, a sphygmomanometer cuff, temporarily to stop it while they do something over here. A newbie surgeon, an amateur surgeon, or a surgeon in training, what they usually do is they are able to put the tourniquet and they are able to mop this area, wash with saline, and clearly see the bleeding artery by playing with the pressure on the cuff, by decreasing and seeing where the spurt is coming from. And they usually clamp it with the artery forceps, and then they, below the artery forceps, they tie it with a suture. And then they're like, yeah, we have saved this person from bleeding. But then what that clamping with the artery forceps and the ligation does is it shortens the healthy tissue on the arterial ends, and then later end-to-end anastomosis. Later anastomosis of the cut parts may not be possible. So that's not good. So the best thing to do is, I have seen a lot of such cases. So the best thing to do is, when someone is bleeding, let's imagine the person has reached a hospital. Even if he or she has not reached the hospital, the same thing can be done anywhere, on the roadside as well, or even at home. So a lot of blood is going to spurt. So what we need to do is, for the initial few seconds, just raise the hand. Don't try to keep it down and press with something. Raise the hand, let it bleed for a moment, for a few seconds. Then you tie on the arm with a belt or something very tight. Momentarily, it's just for a few seconds, so it's okay. So you tie with something very tight. If you are in the hospital, use a blood pressure monitoring cuff. Since the patient is injured, some temporary pain over here because of that high pressure is tolerable. And then you take gauze or a pad, cotton pad with the gauze covering, or just gauze pieces. Make it slightly thick. If you have a cotton pad, you fold it 2 times, or you can use 4 or 5 pieces of gauze, soak it in saline, and then squeeze it off. So when you squeeze it, it's like a wet gauze which has been squeezed out, or wet cotton pad which has been squeezed out, and it becomes like a hard ball, like a small potato. Okay, so you put that small piece over the bleeding artery, over the bleeding site over here on the radial artery, and then you use a bandage. You use a bandage to tightly tie and do a compression bandage just on this area. Don't worry about the rules of bandaging coming from distal to proximal. Don't go into those fancy stuff. We are trying to stop the bleeding without damaging the artery. So you put that folded small piece over here on the bleeding side and make it tight, and then keep the hand raised like this for a long time, for 5 to 10 minutes. 100% of the time, the bleeding stops whenever I have done it. So if your bandaging is a little loose, it may bleed. You might have to do the bandaging again, but most of the time it will stop. So you can, when you have done the compression bandaging with that small soak pad or gauze, and then a tight bandaging, and you have raised the hand up like this, you can remove that tourniquet. And then because of this anti-gravity action, raising the hand up and the tight bandaging, the bleeding artery will stop. So if you're at home or in the roadside, you don't really need to think so much about sterility and all over here when you're already injured with something contaminated. So you can take a handkerchief or piece of cloth, make it wet, fold it like a small block. Okay, fold it multiple times. Let me show you. Let's say this is a piece of cloth. Make it wet, squeeze it off, and make it this small. This is the size that we want. Keep it on the bleeding side and bandage it tight. Wrap it up tight with a t-shirt or other piece of cloth, and then keep the hand raised. So when we keep the hand raised in the hospital, we use bandages like this over the upper limb, and then we wrap it up with another bandage and we hang it on some IV stand or something. So for that, anyone can hold the hand for the bleeding person at home or while they are in transit towards the hospital. So if all this is done when they reach the hospital, you would have saved a lot of blood from being lost. And so knowing this is really important for any doctor or for any non-medical as well. So there's nothing to worry. A lot of people, they call us up and say that the bleeding is not stopping, and it's quite scary for a young new doctor to see that kind of bleeding. And what they do is they just keep putting pad over pad, and they say that the bleeding is not stopping, as if the bleeding is going to stop itself. So the anti-gravity action, the pressure, the elevation, and when you're doing all that, you need a temporary complete stop by using a tourniquet for a few seconds. So yeah, all this can be done within 1 or 2 minutes. So the moment you see someone bleeding, put something tight, squeeze it very hard to stop the arterial flow. Then you can raise it, then you can wash it off, then take the cloth, gauze, pad or something like that, squeeze it off, put it, make it very tight, and raise the hand. That's all. That's all you need to do. I hope you enjoyed this video, this instruction on how to stop the bleeding artery. And this is specifically only for the radial artery or the ulnar artery. And yeah, why we want you to make it small and place it over that particular site is when you're bandaging very tight, the pressure should be on that bleeding site and not on the other artery, on the ulnar. If let's say the ulnar is bleeding, you want to put pressure on that and not on the radial. So if you put a complete Like if you put the bandage all around and then make it very tight, you will extend, you're obstructing the blood flow to the hand. So you want to keep that like that tight bandage for few hours or for the whole night. So you don't want to stop the arterial flow to the hand. That's why we want to put pressure, like focused pressure on the radial artery or the ulnar artery, if that is the one which is bleeding, and no pressure or minimal pressure on the other artery. We don't want to stop the blood flow to the hand. Thanks a lot for watching. See you in the next one.